Hi, my name is Emily Boucher, and today I will be presenting on a Meleis transitions theory. So I chose this theory because as an inpatient oncology nurse, I work with people who are experiencing transitions every day. My concept map is focused on the nurse's role in caring for a patient with a new cancer diagnosis, as this is something I come across quite frequently in my practice. We first start with an assessment piece. During the assessment, we want to assess the patient's goals. This could include conversations about the patient's goals of care. They may want aggressive treatment to treat their cancer, or they may not want any treatment and just focus on comfort. Or they could want something in the middle, not super aggressive treatment, but treatment nonetheless. As part of this assessment, the nurse should also ask the patient about different roles they have in their life. Maybe they're the breadwinner of their family and will be out of work for an extended period of time while they're receiving treatment. Or maybe they're a caregiver for someone else. It's important for the nurse to discuss these roles with the patient to determine resources the patient may need down the line. Next is the trigger. Meleis states in her transitions theory there are 4 types of triggers. In the case of a patient with a new diagnosis of cancer, it could be a change in health or an illness situation. And finally, as part of the assessment, the nurse needs to discuss with the patient their lived experience and how this could affect their treatment. So this includes topics such as nationalism, gender, socioeconomic status, religion, and culture. And I'll give you a couple examples of how this could impact the patient's care. So, for example, if the patient is an illegal immigrant, they may not be able to have follow-up appointments. And these are very important for patients going through cancer treatment. So their treatment may have to be adjusted around this. Another example could be if a patient's a Jehovah's Witness, this will then require them to have bloodless medicine. And many chemotherapies drop the patient's blood counts and require them to have blood transfusions. The plan of care for these patients may need to be adapted based off this, so it is important to know this information at the start of their treatment. The next section of this concept map is identifying milestones. There are several milestones within a patient's cancer journey. So these can include the start of treatment, remission, recurrence, if the patient were to pass away as a result of their cancer, or on the flip side, if they experienced a cure of their disease, as well as critical points. Meleis defines critical points as points where we need to ask questions about a care trajectory or when new signs and symptoms show up. And typically these points require some sort of nursing intervention. So for a patient with cancer, a critical point could be their nadir after receiving chemotherapy. A patient's nadir is typically 7 to 10 days after receiving chemo, and it's when their counts are at their lowest. So it's really important to closely monitor patients during their nadir because they may need a blood transfusion, and they're also at a much higher risk of infection as their white count typically drops as well. It's important to know when these critical points may be so that we can prepare for them. The next section is interventions. It's important for the nurse to sit and speak with the patient as well as their family about their diagnosis. In a qualitative study titled Transitions of Male Partners of Women with Breast Cancer, Hope, Guilt, and Quality of Life, Duggleby et al. Examined the transitions males go through when their partner has a breast cancer diagnosis. They found that the men often had to change their roles, which had a large impact on their mental health. A similar study titled Patterns of Response in Parents of Children with Cancer, an integrative review, found that parents of children with cancer often had to redefine their own identity. It's important not only to discuss with the patient how they're doing, but also with the patient's family. During these conversations, the nurse can once again discuss the goals of the patient and their family. A patient can change their goals of care at any time during their cancer diagnosis, and it's important to continue these conversations with them throughout their diagnosis. The nurse can also help the patient and their family to find resources such as support groups. And the nurse must also identify learning barriers as well as provide education to patients and their families. A huge part of being an oncology nurse is providing constant education, whether it be about chemotherapy and its effects or when the patient should seek medical attention. The patient could also need teaching on how to use a new piece of equipment, such as a feeding tube or pleuric drain, both of which are very common in patients with cancer. It's also very important for us to understand this connection right here of the learning barriers affecting the nurse's education. And it's really important to be able to identify these to then tailor the nursing education to fill in those gaps. This is another really important connection for us to understand between critical points and interventions. A critical point can impact what interventions are done the same way interventions can impact critical points. For example, if a patient needs to be hospitalized due to a severe side effect from their chemotherapy, they most likely won't be able to receive that agent in the future. And then this would become a critical point in their transition that would then affect further future interventions. The next part of this is evaluating outcomes. So Meleis identifies 5 different outcome patterns. This includes mastery, fluid and integrative identity, healthy interactions and connections, becoming resourceful, and perceived well-being. A patient can become resourceful when they know whom to seek help from, as well as where they can find resources when should they need them. As described previously, it's important for the patient's relationships to remain healthy. Their diagnosis affects those around them, such as their parents or their spouse, and it's important that those people in their lives also remain healthy. A patient's integration back into regular life or fluid and integrative identity could be the patient returning to their normal roles and routines while continuing their cancer treatment. In this case, mastery could be described as a patient's remission or as a patient's death, should their goal switch to comfort rather than cure. And finally, Meleis describes perceived well-being as being subjective according to the patient experiencing the transition or their caregivers. And once again, there's a connection between goals on either side as well as outcomes. So outcomes can affect the goals and goals can affect the outcomes. A Meleis transitions theory is a middle range theory grounded in role theory that discusses what happens during a transition. Role theory is a paradigm developed by Dr. Ralph Turner that explores how one transitions from one role to another, how one takes on a new role, or how one changes their behavior within a role. According to Meleis, there are 4 different types of change triggers: change in health or an illness situation, developmental transitions, situational transitions, and organizational transitions. The concept map on the previous slide was an example of a change in health trigger. Developmental transitions occur throughout life when one ages, for example, the change from an adolescent to a young adult. Situational transitions all have healthcare implications. For example, an adult being admitted to the hospital, or on the flip side, being discharged from a hospital back to home. And finally, organizational transitions occur within an organization as a whole. So for example, a CEO beginning at a company, a new CEO beginning at a company would cause a transition that the entire organization would then have to go through. There are 5 different properties that define a transition other than just having a triggering event. And these include time span, process, disconnectedness, awareness, and milestones. The time span of a transition is fluid. It can begin from the time the trigger happens, or it could begin from the moment the person is actually aware of the transition that is occurring. The end is also fluid. It could end once the final goal is achieved, or when the person feels comfortable in their new role. Process is the experience that comes after the change event, and disconnectedness is the feeling of actual or impending disruption in the person's life who is experiencing the change. Awareness is the person's awareness that the change is occurring, and milestones are critical points or turning points within the transition, as discussed on the previous slide. Another key concept of the transitions theory are patterns of responses. These include process patterns and outcome patterns. Process patterns include degree of engagement, location and being situated, follow-up, and level of confidence. The level of engagement is the amount that the person going through the change is involved in the transition process itself and the level of engagement may have direct impact on the final outcome. Location and being situated is when the person recognizes their position within the healthcare system and can indicate their level of understanding of what is happening with their health. The timeliness that someone follows up to recommendations that have been provided to them during their transition, as well as timeliness of interventions, can affect the outcome. And finally, level of confidence is related to how the person handles the transition process itself. There are also 5 outcome patterns defined by Meleis, which we discussed in the previous slide. These include mastery, fluid and integrative identity, health interactions and connections, becoming resourceful, and perceived well-being. The final piece of Meleis transitions theory is intervention. Meleis defines the goal of intervention as initiating, facilitating, supporting, and inspiring healthy transition process and outcome responses. And this can be done through a variety of interventions, such as providing expertise, modeling the role of others, setting goals, and activating resources. When we examine this through the nursing meta paradigm, the person is whoever is experiencing this change. Environment is made up of these change triggers and could also be wherever this change is taking place. The nurse helps the person through this transition by providing holistic care, and health is having a positive outcome from this transition. Here are my references for this presentation. Thank you for your time.